Hello guys, today we'll be talking about pneumonia, and we'll be talking about pneumonia under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is pneumonia? Pneumonia is an acute or chronic inflammation of the lung parenchyma, particularly the alveoli and interstitial tissues of the lung, which could be due to infection from microorganisms, inhalation of irritants, as well as secondary involvement of systemic disease. Pneumonia is one of the commonest, as well as one of the most serious respiratory diseases that affects or that cause morbidity and mortality across all age groups. Clinically, pneumonia is characterized by fever, chills, production of productive or unproductive cough, pleuritic chest pain, as well as radiological evidences of pulmonary infiltrates. Pneumonia is divided into various types, and this division into various types is based on certain categories. First of which is anatomical position. Here we have lobar pneumonia, bronchopneumonia, as well as interstitial pneumonia. Also, pneumonia is categorized based on etiology, where we have viral pneumonia, bacterial pneumonia, fungal pneumonia, parasitic pneumonia, as well as non-infectious pneumonia as well. Also, pneumonia is characterized based on acquisition setting, where we have community-acquired pneumonia, hospital-acquired pneumonia, as well as ventilator-associated pneumonia. Understanding the epidemiology, the causative agents, the pathophysiology, as well as the pathogenesis and determinants of pneumonia contributes immensely to effective diagnosis, prevention, and management of pneumonia as a condition. So let's talk about the causative agents of pneumonia. Pneumonia is caused by various agents. It can be caused by bacteria, can be caused by viruses, by fungi, by parasites, and there are also non-infectious causes or etiology of pneumonia. Bacterial pneumonia is the commonest as well as the most clinically significant forms of pneumonia. Certain bacteria are involved or are predominant in causing pneumonia, and they include: first, we have the Streptococcus pneumonia. Streptococcus pneumonia. Streptococcus pneumonia is the leading cause of community-acquired pneumonia. Also, we have Staphylococcus aureus. Staphylococcus aureus, including the MRSA as well. That is the methicillin-resistant Staphylococcus aureus. Staphylococcus aureus is particularly predominant in cases of severe necrotizing pneumonia. Also, we have Haemophilus influenza. Haemophilus influenza. This is also a very important cause, a major cause of pneumonia. Also, there is Klebsiella pneumonia. There is Klebsiella pneumonia. Klebsiella pneumonia is predominantly involved in causing pneumonia in hospital acquired cases and also in alcoholics. Also, there is Pseudomonas aeruginosa. Pseudomonas aeruginosa. Pseudomonas aeruginosa is involved in causing pneumonia in patients with cystic fibrosis. Cystic fibrosis is a condition, a genetic disorder that causes accumulation of thick mucus in the lungs, in pancreas, as well as other organs, and it causes issues or complications in nutrient absorption as well as recurrent infections, among other complications. So Pseudomonas aeruginosa is particularly involved in causing pneumonia in patients with cystic fibrosis, also in patients with immunocompromised conditions. Other bacteria that are involved in causing pneumonia include Mycoplasma pneumoniae, also Chlamydophila pneumoniae, as well as Legionella pneumophila. So these are the principal bacterial organisms that are capable or that are major culprits in causing pneumonia. We also have viral pneumonia. Viral pneumonia is particularly caused in children, is more predominant in children, and it is usually caused by viruses, which include we have the influenza virus, particularly influenza A and B virus. So for the viral causes, we have influenza A and B virus, A and B virus. Also, we have the respiratory syncytial virus, respiratory syncytial virus. Also, there is the human metapneumovirus, pneumovirus. Also, coronavirus, especially the SARS-CoV-2, that has COVID-19, and para-influenza viruses as well. Para-influenza viruses. So these are the predominant viruses that are involved in causing pneumonia, especially in children. Also, we have fungal pneumonia. Fungal pneumonia is particularly caused in, is usually seen majorly in immunocompromised individuals. And the major fungal culprits involved in causing fungal pneumonia include pneumocystis, pneumocystis jirovecii, right? Also, histoplasma capsulatum is also a major cause. Capsulatum. Also, Cryptococcus neoformans. Those neoformans, Aspergillus species, as well as Coccidioides species. These are the major fungal organisms that are capable of causing pneumonia in cases of fungal pneumonia. And this fungal pneumonia is more predominant in immunocompromised individuals. Also, there is parasitic pneumonia. Parasitic pneumonia is quite rare. It's very rare. It's usually very rare, but when it happens, it's usually due to two organisms, majorly Toxoplasma gondii, Toxoplasma gondii, as well as Strongyloides Tecarolis. So these are the major parasitic organisms, major parasites that are involved in parasitic pneumonia, although it happens rarely. So there are also non-infectious causes of non-infectious causes of pneumonia, which include aspiration of gastric contents, also inhalation of toxic chemicals, of gases, as well as smoke, and also autoimmune diseases, especially the lupus pneumonitis. So this is basically about the causative agents of pneumonia. Also, let's talk about the pathogenesis. The pathogenesis of pneumonia is basically a complex interplay between the host immune system and the pathogen responsible for causing pneumonia. Pathogens usually have various mechanisms of entering into the respiratory tract and being deposited into the lungs. These mechanisms include one, micro aspiration of oropharyngeal contents. This usually occurs when contents within the or secretions within the mouth and throat are being aspirated into the lungs, and these secretions can contain bacteria, viruses, fungi, pathogens in excess that are capable of causing pneumonia. Also, pathogens also enter the respiratory tract and into the lungs via inhalation of aerosolized droplets. This is basically as a result of direct inhalation of aerosols. These aerosols can contain pathogens that are capable of causing pneumonia. So these pathogens are being inhaled into the nostrils, and from the nostrils they walk through the respiratory tract and gets deposited into the lungs. Also, pathogens get into the lungs to cause infection via hematogenous spread from distant infections, right? Hematogenous spread, usually when there is an infection in the body that metastasizes into the bloodstream, it is possible for that infection, for that pathogen to travel through the blood and get deposited in the lungs. In the lungs, this pathogen can cause pneumonia if it is a pathogen that is capable of causing pneumonia. Also, another mechanism by which pathogens can enter into the lungs to cause infection is via direct inoculation through trauma or through medical procedures. So, however, the immune system has mechanisms that it uses to first of all prevent pathogens from entering the immune system, from entering the lungs, right? The respiratory tract has mechanisms to prevent pathogens from entering the lungs. And even when they enter the lungs, it has mechanisms to neutralize these pathogens. We'll talk about three of those mechanisms. First of which is the mucociliary clearance. Mucociliary clearance. Also, alveolar macrophages and surfactant proteins. Surfactant proteins. Well, let's talk about the mucociliary clearance. Okay, let me sketch the respiratory tract to explain this. Oh, not the best in drawing. Okay, so let's say this is the respiratory tract. Sorry. So this is the respiratory tract, right? Okay. These are your bronchioles and bronchi. Well, this is a rough sketch of the respiratory tract. For the mucociliary clearance, is a mechanism that the respiratory tract uses to prevent pathogens from entering the lungs in the first place. So how does it work? Usually, when pathogens are inhaled from the nostrils, these pathogens flow into the respiratory tract with the aim of getting to the lungs. So what happens is this: the respiratory tract has mucus present within the tract. These mucus are slimy, moist substances that have the capability of trapping these pathogens. They are present within the tract. They have mucus present within the tract, within the respiratory tract. So this mucus traps the pathogen. It traps the pathogen, right? Traps the pathogen within the respiratory tract. And then it also has it also has cilia. It's called mucociliary clearance. That is, there's a presence of mucus and cilia. Cilia are hair-like structures within the respiratory tract. They are hair-like structures propel the propel the pathogen upwards. So first of all, the mucus traps within the respiratory tract. The mucus within the respiratory tract tracks or traps the pathogen, and then cilia, that is hair-like structures within the respiratory tract, propel the pathogen upward. And when these pathogens are propelled upward, they are then coughed out through the nose or expectorated through the nose. Some other times, these pathogens can be trapped by the mucus and propelled upwards by the cilia, and then they can enter into the esophagus. Let's say this is the esophagus because it's bifurcates here. Enter into the esophagus. In the esophagus, from the esophagus, they enter into the stomach, and in the stomach acid present within the stomach helps to neutralize the pathogen. So this is basically how the mucociliary clearance works. Another mechanism that the respiratory tract uses to neutralize pathogens is the alveolar macrophages. The alveolar macrophages come into play when the pathogen bypass the mucociliary clearance. That is when the pathogen has passed through the respiratory tract and enters into the lungs. Within the lungs, okay, let's say this is the pathogen that passed through evaded the mucociliary clearance and then enters the lungs. Okay, let's say this is the pathogen, right? Within the lungs, this pathogen is being engulfed by alveolar macrophages. So let's say these are alveolar macrophages. This is an alveolar macrophage, and this is a pathogen, right? The alveolar macrophage engulfs the pathogen through a process known as the phagolysosomal fission. The phagolysosomal fission is a process in which the alveolar macrophages use to eliminate and neutralize pathogens. So let me explain how that process happens. So let's say this is the pathogen, and then this is the alveolar macrophage. The alveolar macrophage, okay, macrophage, then pathogen. Pathogen can be virus, bacteria, fungi, parasite, as the case may be. So when the pathogen first of all is engulfed by the macrophage, and then within the macrophage creates a vesicle to enclose the pathogen. The vesicle is present here. The macrophage forms a vesicle to enclose the pathogen. This vesicle is known as a phagosome. Phagosome, right? The vesicle is known as a phagosome. And then within the macrophage, within the alveolar macrophage, there are lysosomes within the alveolar macrophage. Then the macrophage opens up, perforates the phagosome within the macrophage, perforates and allows these lysosomes to enter into the phagosome that contains the pathogen, right? You know, lysosomes have digestive enzymes. So these digestive enzymes that is present within the lysosomes then neutralize the pathogen within the phagosome. So this process is known as the phagolysosomal fission. Lysosomal fission. The phagolysosomal fission is the process that alveolar macrophages utilize to neutralize and destroy pathogens present within the lungs. Another mechanism that the immune system and the respiratory tract uses to get rid of pathogens within the respiratory tract or within the lungs is through the use of surfactant proteins. We have surfactant protein A, B, C, and D. Surfactant proteins function by reducing the surface tension of the alveoli, preventing alveolar collapse. They also function by directly inhibiting and destroying pathogens present within the lungs. So these are basically the three mechanisms in which the respiratory tract uses to protect itself from pathogens. But some pathogens have certain virulence factors that make them resistant or that make them evade or overwhelm these mechanisms, right? Some of these pathogens have capsules, they have biofilms and certain toxins that make them evade these mechanisms. of the respiratory tract to protect itself. For example, Streptococcus pneumonia is basically an encapsulated pathogen, an encapsulated bacteria. And because of the presence of its capsule, it is able to evade phagocytosis. That is, for example, the alveolar macrophages cannot phagocytize it because of the presence of its capsules. Also, Staphylococcus aureus possesses cytotoxins, and these cytotoxins make it cause tissue necrosis. Also, viruses such as influenza virus may damage the respiratory epithelium, causing or predisposing the lungs to secondary bacterial infection. However, an interesting thing to note is these pathogens that evade these three mechanisms of mucociliary clearance, alveolar macrophages, and surfactant proteins, the immune system doesn't just allow them to replicate and cause diseases, right? When these pathogens have evaded this mechanism, the immune system does something very interesting. It causes the release of cytokines, especially interleukin 1, interleukin 6, as well as tumor necrosis factor alpha. So the immune system causes the release of interleukin 1, interleukin 6, and tumor necrosis factor alpha. So these cytokines, when they have been released as a result of the pathogen evading this first line of defense, right? When these cytokines have been released, they cause the co-stimulation and release of neutrophils. So let's say this is a pathogen, right, within the lungs that has evaded mucociliary clearance, alveolar macrophages, and surfactant proteins. Cytokines are released, interleukin 1, 6, tumor necrosis factor alpha are released, and they cause the release of neutrophils. These neutrophils now surround the pathogen within the lungs, right? And these neutrophils, in the goal to eliminate and neutralize the pathogen, they cause the release of certain chemicals to do so, to neutralize this particular pathogen. They cause the release of certain chemicals, and these chemicals are adverse to the alveoli of the lungs, causing inflammation of the alveoli of the lungs. Usually, the alveoli of the lungs, right, have the physiological function of gaseous exchange. They help to transport carbon dioxide from the blood to the respiratory tract, and then gets released through the nostrils, and then they cause aspiration of oxygen to the lungs and then to the bloodstream, where the oxygen will be used for various metabolic activities, right? But when they get inflamed due to release of toxic chemicals by neutrophils, it can cause inflammation, right? And this inflammation is adverse to the alveoli, can impair gaseous exchange and oxygen diffusion, which can lead to hypoxia or respiratory distress. However, if the neutrophils eliminate this pathogen, resolves this pathogen, right, on time, the alveoli recovers from the inflammation. If the neutrophils neutralize the pathogen, then the alveoli of the lungs get restored to its normal physiological function without continuing in inflammation that inhibits its activity. But if this inflammation becomes chronic, it can be really adverse. It can cause formation of empyema. It can lead to lung abscess formation. It can also cause acute respiratory distress syndrome, and in advanced cases, it can cause septicemia as well as multi-organ failure in some cases. So this is basically the pathogenesis of pneumonia. So let's talk about the epidemiology of pneumonia. Pneumonia is one of the leading causes of hospitalization and deaths worldwide, right? It is a major cause of morbidity and mortality in children, especially children below the age of 5, in elderly individuals, as well as in immunocompromised individuals. Viral pneumonia is more common in children. Adults more commonly experience bacterial pneumonia, especially by Streptococcus pneumonia. And also, the elderly have higher risks of hospital-acquired pneumonia, as well as ventilator-associated pneumonia. Pneumonia is more predominant in countries or in regions that are low income and middle income, especially due to poor accessibility of healthcare facilities, overcrowding, as well as poor vaccination rates. Viral pneumonia is more common during the winter because in winter, people are more indoors, right? Which increases contacts, and contact among individuals has a way of promoting transmission of viral pneumonia. Also, during winter, there's also prevalence of cold air, and cold air has a way of drying up the mucus present within the respiratory tract, and drying up of this mucus reduces its functionality, thus enabling the smooth transmission of viruses from the atmosphere to the lungs, where it can lead to viral pneumonia. Let's talk about risk factors. There are certain risk factors that predispose an individual to getting infected or coming down with pneumonia. These factors can be host related, can be environmental and behavioral, and can also be clinical. In the host related factors, we have age. Age is a predominant cause of pneumonia, right? The elderly and children, especially below the age of 5, are more predisposed to developing pneumonia because they have a weaker immune system, right? Also, there is patients of chronic, being a patient of chronic disease such as asthma, heart failure, and chronic obstructive pulmonary disease, diabetes mellitus, among other chronic infections. Being a patient of a chronic disease increases or predisposes an individual to coming down with pneumonia. Also, malnutrition as well as immunosuppression. Immunosuppression, such as HIV infection, patients of chemotherapy, and transplant patients have a greater susceptibility to coming down with pneumonia. Also, having genetic disorders that affect the immune system, such as cystic fibrosis, can influence an individual and increase the risk of getting or coming down with pneumonia. There are also environmental and behavioral factors, such as smoking. Smoking cigarettes increases the chance of coming down with pneumonia. Alcohol misuse. Alcohol misuse particularly makes an individual prone to being infected with Klebsiella pneumonia, which causes pneumonia, a bacterial pathogen that causes pneumonia. Also, air pollution and occupational exposure to irritants such as chemicals, smokes, gases increases an individual's likelihood of getting infected and coming down with pneumonia. Also, overcrowding and poor sanitation are also important factors that influence an individual getting pneumonia. Also, there are also clinical factors that play important role too in developing and coming down with pneumonia, such as prolonged hospitalization. When someone spends a lot of time or has a long time in the hospital, that individual has a greater likelihood of coming down with hospital acquired pneumonia. Also, prolonged use of um, immunosuppressive drugs such as corticosteroids and broad spectrum antibiotics, also anti-tumor necrosis factor agent as well, makes an individual prone to developing, coming down with pneumonia or being infected with pneumonia. Also, the use of mechanical ventilation in the hospital also increases the likelihood. Let's talk about diagnosis. The diagnosis or effective diagnosis of pneumonia is a smooth, synergistic interplay of clinical evaluation, imaging, as well as laboratory investigation. Clinical evaluation is done by a physician who looks at the patient and checks out for signs and symptoms that are peculiar to pneumonia. Such signs include fever, chills, pleuritic chest pain, dyspnea, that's fast breathing, that's difficulty in breathing, tachypnea, fast breathing rates. All these are signs and others as well that clinician checks out for to diagnose or suspect pneumonia. They are also imaging is also another important component of diagnosis of pneumonia. Chest X-ray is the primary diagnostic tool used in detecting pneumonia. Chest X-ray checks out for lobar consolidation, checks out for interstitial infiltrates, checks out for cavitations as well as abscesses. Lobar consolidation is suggestive of bacterial pneumonia, while interstitial infiltrate is suggestive of viral pneumonia. So this gives an idea of the etiology of the pneumonia infection. Also, CT scan, that is the computerized tomography scan, is also used. It is more sensitive than the chest X-ray, but it is usually used in complicated and unclear cases. Also, laboratory investigation is also involved in diagnosis of pneumonia. Complete blood count, that's full blood count, is done to check out for leukocytosis or leukopenia. Use checking of serum inflammatory markers is also done, such as the um, C peptide, that's the C reactive peptide levels, erythrocyte sedimentation rates, as well as procalcitonin levels are also checked. Liver and kidney function tests are also checked or done or performed to assess the severity of pneumonia. Also, sputum gram staining and culture, as well as blood culture, are performed or carried out to detect bacterial etiology of infection. Also, the polymerase chain reaction, that's PCR, is carried out to check or detect viral pathogen and also check out viral load as well. Bronchoalveolar lavage is also done for severe and hospital-acquired cases. So let's talk about prevention and control. The most effective preventive strategy against pneumonia is vaccination. Important vaccines that are used is the pneumococcal vaccine. Pneumococcal vaccine prevents from Streptococcus pneumoniae infection, which is one of the leading causes of pneumonia. These vaccines include the PCV13, PCV15, PCV20, PPSV23. Also, there is the use of influenza vaccine. Influenza vaccine is usually used annually, especially for children. Also, Haemophilus influenza type B vaccine is also given to children as well. Also, coronavirus or COVID-19 vaccine is used and given to children and adults as well. There's also the use of infection control measures as a prevention and control strategy, which includes the use of good hand washing hygiene, right? Hand washing hygiene, respiratory etiquette, which involves coughing into the hand, into the elbow, sneezing into the elbow to prevent transmission of pathogens. Also, isolation of infected individuals plays an important role in curbing the transmission of pneumonia. So, very important to note is reducing risk factors. Reducing risk factors such as cessation of smoking, um, control of alcohol intake, reducing air pollution, as well as reducing air pollution, as well as controlling and improving nutrition as well. These are preventive strategies and control strategies that are used in curbing the spread of pneumonia. Let's talk about treatment. The treatment of pneumonia involves or is based on age of patients, based on comorbidities, based on severity of damage as well, right? Bacterial pneumonia is usually treated using bacteria or antibiotics such as amoxicillin, azithromycin, doxycycline, and certain fluoroquinolones. Viral pneumonia is treated using agents such as the oseltamivir, remdesivir, depending on the viruses involved. And also, fungal pneumonia is treated using the TMP SMX, usually for Pneumocystis jirovecii. Also, there's the use of amphotericin B, itraconazole as well, depending on the fungal agents involved in infection.